Perimenopause, meaning around menopause, is the time when a woman's body makes the natural transition to menopause. On today's show, we're going to take a closer look at the effect of perimenopause, what it has on women and their families. And as always, we're going to answer your questions. All that and much more coming up on this episode of Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, everyone, and welcome to Ask the Doc, No Appointment Needed, the show where the health questions you send in get answered by experts in the field. I'm Olga Villaverdi, and today we're going to discuss perimenopause. And we're so pleased to be joined by licensed mental health counselor, Dr. Rachna Buksani-Amirpuri. Dr. Buksani, thanks so much for joining us today.
Thank you, Olga. Thank you for having me and for discussing this very confusing and very important topic.
And I got to tell you, it's paramount to discuss it and be open about it. Even for a woman like me, I've been experiencing all these symptoms that I want to get to as well. But first, let's get to our first question from Shelley. And she writes a really good one that I can relate to. I'm so glad you're tackling this topic today. I know I have been irritable and cranky lately. What are some of the other symptoms I need to be aware of? So again, so many good questions that we're going to have. This is one that I think a lot of women can relate to, doctor. But before we get to her question, I do want to share a short video from the Mayo Clinic that talks a little bit about perimenopause. Let's take a look.
Perimenopause is described as the time leading up to menopause. And menopause is defined as you haven't had a period for a year. So perimenopause is that length of time that leads up to that when your hormones haven't really settled down yet, and in fact they're going crazy. Your hormones can be higher and swing lower than they ever did during your entire reproductive life. So you get these vast swings. So if you end up here, where do you have to go? You're going to fall. So when the hormone levels then fall, you're hot flashing and having night sweats, and your mood may be all over the place. So it's a time of great transition, both in terms of what's happening hormonally and what's happening physically. While we know that exercise has had mixed effects on these hot flashes and night sweats, it certainly does help with health in general. It makes you feel better, it makes you sleep better, your quality of life is better, so it's a good idea. But also understanding that the rules of your body change during perimenopause and entering menopause. So we know now some very interesting things, that your metabolism actually slows a little bit, but also women going into menopause don't move as much. So that can contribute. And then here's the kicker. All the weight that you do have goes right to the middle section. So it's very frustrating for women because all of a sudden the rules of your body that have governed you for your entire life, they don't work anymore.
Oh my gosh, I relate to that little muffin top that's happening to me. What a great way to start this show. Doctor, what else can you add?
Wow, there are so many. And you know, every person is unique. So every woman who's experiencing this is unique. So I'm going to list out a bunch of things that happen. That doesn't mean everything is going to happen to everyone, right? I just want to clarify that. So some of the things that we see, you know, like she mentioned in the video, obviously we see sleep disturbances, we see brain fog, we see fatigue. Fatigue's a big one, right? Like, why am I so tired all of a sudden? We see that weight gain, and especially around the abdomen area. We see skin changes, hair changes, so hair loss. Skin becomes dry all of a sudden. I have hot flashes, headaches, joint pain, the ever famous frozen shoulder, breast tendencies, vaginal dryness, right? So there are so many different symptoms of perimenopause. And again, not everybody experiences everything. So you really have to see what you are experiencing and then put things in place to be able to manage those. And of course, the big one is the moods, right? Which is why I'm here. The mood swings, the anxiety, oh my gosh, am I going crazy? Why am I anxious all of a sudden? Why am I depressed? So all of that makes up the phase of perimenopause.
All right, thank you, doctor. We have another question. It's coming in from Jillian, and they emailed us. So let's see what they write. I'm 42 years old, and I feel like the symptoms that were just mentioned are what I'm dealing with. I always thought of perimenopause and menopause affecting older women. Is that what is happening to me, or is there something medically wrong with me? That's really a great question because I have a friend of mine that told me in her early 40s, she started feeling what I'm feeling today, and I'm in my late 50s. So, whew, for me, I got it a little later, doctor.
Yes, yes. And that I agree. Great question. Because I think there's that confusion over there, right? So the average age of menopause and what we know menopause is 12 months of not having a period, right? So the average age of menopause for a woman is 51 in America, right? So if give or take 8 to 10 years before that is when we start seeing perimenopausal symptoms. Now, that's the average age. Some people might start experiencing perimenopause symptoms in their late 30s, and that's because maybe they have a family history or genetics that dictate that they're going to go into menopause earlier than that age of 51, right? And then for some women, it's later. So yes, that age of 42 sounds like she would be entering that perimenopause phase. So she's not off the mark there. Now, what we need to do is be able to navigate those years whenever it does start. So whenever we do start seeing that, okay, I'm feeling this way, I'm feeling a little more anxious, my sleep is disturbed, my breast is tender, I'm having maybe some hot flashes, I need to take those seriously and need to definitely consider that it's most likely perimenopause.
And doctor, you mentioned something really important about, 12 months of starting to not have a period. I'm going to be honest, and I know there is someone out there like me, many women. I had a hysterectomy. So for me, I really didn't have the signs, right? And they just kind of started popping up because my best friend started losing her menstrual cycle while I obviously didn't have one. And then Shazam, things just started happening. So I didn't even
Of
have that
course.
little heads up, if you will.
Of course, of course. And remember, it's 12 months consecutively of not having period, because even that's confusing. Because the other part about perimenopause is the irregular cycles, right? So I might not have it for 2 months, but then I might get it in third month. That does not so you have to really have 12 consecutive months of not having a period.
Great point. Thank you, doctor. All right, we got a question coming in from Ralph, and this is what he has emailed. He put, "Hi, Dr. B. I've actually given a different name so my wife doesn't know it's me. You've talked a lot about what women go through, but what about their spouses? This has been a really tough time, and to be honest, I'm trying to work as much as possible. Appreciate any advice you can give." I got to tell you, I'm so glad Ralph sent this question because we talk so much about what we're going through, but the spouses are also going through, and it's not easy.
Yes, absolutely. It's not easy because there's that lack of awareness, and that's does the lack of understanding. However, even if you do understand, that does not mean that it's easy to navigate that. So yes, Ralph, I know you've hidden your name, but we're going to call you Ralph for right now. Thank you so much for reaching out. And I think this is so important. So understanding the symptoms of perimenopause helps you not take things personally, right? So if your wife is going through something and then she's anxious or she's agitated, you're going to be able to take a step back and say, okay, this is not about me. And it also helps you offer that empathy and be patient as much as you can with your wife, knowing what symptoms are going through. Understanding yourself is very important. So if you're the empathetic, I'm a listener person, then great. Then that's what you offer to your wife, right? Like be there non-judgmentally, validating what she's going through. If you're the fixer, then that's what you offer, and ask her, what is it that you can do to take care of things that lightens the load on her? Most importantly, take care of yourself, right? Because there's nothing that you're going to be able to achieve, or you're not going to be able to handle this phase along with your wife if you don't take care of yourself. So engaging in activities that you enjoy, seeking out support from family, from friends, very important, because that's kind of what's going to help you navigate this difficult phase.
Exactly. And knowing that it's temporary, right? Because it's not permanent. So, like I tell my husband, listen, I know I've been cranky lately, but, just give me a little bit of time. This is going to end one day. And he kind of says, it's okay, sweetheart, I get it. But it's true. It's
It
temporary.
is, it is true. It is true. And yes, and not every woman is going through this for 10 years. So, just know that for some it's a few years, for some it's longer, but yes, there's an end point to this.
Excellent. All right, doctor, thank you for your insight. And by the way, if you have some questions and you don't know how to send them in, it's really easy. Take a look.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So let's get to our next question. And this one is from Val. She emailed, and this is what she writes. I always considered myself a calm and rational mother, but lately I find I'm very emotional, raising my voice and yelling and screaming at my kids. This sounds like some of the perimenopause symptoms you have been talking about. What can I do to change my behavior? Well, one thing that I do, Val, and I'm going to tell her right now, is I go on long walks and I just kind of enjoy the environment outside. And then I come back and I'm a different person. But that's just me, doctor. What do you say?
So I'm glad you do that, Olga. And I believe exercise has never been as important for a woman as it is in this phase, right? So whatever you need to do, get yourself up and get yourself going, because exercise is extremely important. Oh my gosh. What research has found is that it's, one of those top things that's going to help you navigate perimenopause. So I'm glad you're doing that. Coupling that with some muscle building exercises. So whether that's Pilates or whether that's, some strength building exercise, very, very important. And plus the low impact, right? So you want to keep it where you're building strength, but it's not impacting your knees and all of that. But yes, exercise, very important. Your diet, taking care of, what you're putting into your body. So avoiding too much alcohol, avoiding nicotine, minimizing coffee, all of those things are going to help navigate and those symptoms that we feel. Relaxation, right? So things like yoga, meditation, breathing exercises. When I'm, feeling anxious, or if I feel like, oh my gosh, I'm losing my mind, doing some of that breath work is so powerful. And making self-care important. I remember there's this one person, one of my clients who's going through perimenopause, and we both are kind of in the same age range, and we were talking about it. And I looked at her and I said, you know what? You've just got to allow yourself to do what feels right to you in the moment. Listen to your body. We as women find it extremely hard because we have our to-do list and we feel like we need to, take care of everybody else. But this is really the time you need to take care of yourself, because it's a very profound phase that we go through. So making sure that you're giving yourself what you're trying to give others is extremely important. And
Which leads me
communicating to your family, letting them know what's going on, because they'll understand. Kids, if they're teenagers, or if they, I like to let them know, hey, I'm really tired. You understand, I'm going through perimenopause. I'm really tired. I just need to take a nap. Or telling your husband, listen, honey, I love you, but I need to take a nap now for 45 minutes and I don't need anybody disturbing me. It's completely fine to ask for those things.
Absolutely. And I love what you said about listening to your body and, helping your mind. And this next question is perfect for you, doctor. It's from Leah, and she writes the following. Dr. Buksani, is there a connection between the mind and the body when it comes to perimenopause? What an interesting question, doctor.
So I believe there's a connection, the mind-body connection, no matter what we're going through, right? So let's talk about how mind and body are connected with perimenopause. So symptoms like lack of sleep and hot flashes and brain fog and fatigue, they are a result of the fluctuations in hormones that we see during perimenopause. But guess what? The lack of sleep and the fatigue is also going to affect my mental health, right? So of course, when I am not sleeping well, if I'm not, feeling like myself, it's going to make me feel sad or depressed. It's going to bring about feelings of anxiety. So that's how the mind and body are always connected, but especially in perimenopause. You really do, again, I'm going to go back to exactly what I said in the previous question. You really have to take care of yourself, eating right. I cannot emphasize enough, please exercise. Even if you've never been an exercise person, this is the time to start. Please get up and get moving, because it's really, really going to help you. Do things like yoga, practice meditation, even if it's for 2 minutes, if it's a guided meditation, do it. Focus on breath work. It's really going to help you at those times when you feel anxious. And spending time with nature, which is exactly what you were saying, Olga, where, going out and just spending time in silence within, looking within, but spending time in the joyful nature that we have surrounding us is going to be extremely helpful.
It helps tremendously, let me tell you. All right, doctor, I just want to remind our viewers that if you don't get your questions answered today, don't you worry. You can actually go to our website. It's fantastic. Click on Ask Hannah, and nurses are available to help. You can't miss it. Take a look at this.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hannah. Ask Hannah is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hannah has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit AskHannah.tv today and take control of your health with Ask Hannah. Your health, your way, anytime, anywhere. Ask Hannah, your trusted health companion.
Such a great tool we offer on our website. Please check it out. So our next question comes from Andrea, and this is what she writes. Doctor, let's look. I had a traumatic experience a few years ago, and I noticed that it seemed like my perimenopause symptoms began and actually got worse. Is there any connection between trauma and perimenopause? I'm so sorry for the experience, Andrea, but let's see if we can help out, doctor.
Of course. And again, a really, really important question, because who hasn't been through some sort of trauma, so, and that connected with perimenopause, such an important question to answer. So what we found is, yes, in studies, perimenopausal women report actually higher levels of PTSD symptoms. They may experience an increase in the hyperarousal symptoms that we tend to see as part of PTSD. They might have more difficulty in concentrating. They might have more difficulties with sleep. So yes, and it's interesting, Olga, because it's almost like a bi-directional relationship between perimenopause and trauma, because trauma can impact perimenopausal symptoms, and at the same time, perimenopause can affect trauma symptoms, right? So both can actually affect each other and affect, the triggers that we experience when we have PTSD. So absolutely, and this is more of the reason why somebody really needs to take care of themselves and also seek out a professional therapist, a therapist who works with trauma to help you heal from that trauma. So at least we can mitigate some of those impacts of trauma on perimenopause.
Thank you, doctor. Appreciate that response. All right, our next question comes in from Stacy. This is what she writes. I am 45 years old and approaching the age where perimenopause can begin. What are some signs I need to look for? I'm already moody, so that won't be an obvious symptom. So some signs that start occurring, doctor. I know we touched upon it a little bit, but it's always good to repeat and re-educate.
Yes, and I'm just going to say, Stacy, join the club. We're all mortal. But yes, let's talk about the other symptoms. So some of them that, we've covered, the hot flashes, the irregular menstrual cycles, the sleep disturbances, the fatigue, the joint pain. And that's a really big one because really, if I'm in so much pain all the time, it's hard to be able to want to get up and do stuff. But remember, you do need to get up and you need to push yourself and you need to do stuff. Brain fog, that's a very big one. The weight gain, and that can really affect a lot of women because you almost feel like you're in somebody else's body, right? Like it doesn't feel like you're in your own body. And again, things like frozen shoulder, all of that really impact in a lot of times my quality of life. So being able to do what you can to take care of yourself at this time is extremely, extremely important.
Agreed. Doctor, I just got a great question from one of our Facebook viewers. His name is Jesus. But before we get to it, I just want to tell our viewers, you want to send in your questions. It's so easy. Take a look. Let's show you how.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So a great question, Doctor, from Jesus on Facebook. Jesus, thank you so much for sending this in. Doctor, let me read it to you. Good morning, ladies. Just wanted to ask you about my wife. How do we know when her menopause starts? She just turned 46. So what are some clues and signs that maybe her husband can be aware of?
So I'm guessing first of all, thank you, Jesus, for writing in. I'm guessing what he's trying to find out is more about perimenopause rather than menopause, because we understand menopause is 12 months of not having a period. So I'm going to answer it as if, he wants to know
Sure.
perimenopause. First of all, kudos to you, Jesus. Thank you for asking on behalf of your wife. You will start seeing some of these symptoms that we've talked about. If she's, all of a sudden, it's hard for her to sleep through the night or to fall asleep, or if it's hard for her to get up, or she feels really tired during the day. If all of a sudden she has a lot of aches and pains, I remember I used to, when I started having perimenopause symptoms, my husband was the person who would keep pressing my arm, every night because I had a lot of joint pains, right? So if you're going to see that she's just not herself and she doesn't feel like herself. And she might even say those things to you that, gosh, I don't know what's happening. I don't feel like myself. I'm in so much pain. Or you'll see those other mental health symptoms where she's all of a sudden very anxious, right? Like, and especially if she's not a person who's generally anxious and all of a sudden starts experiencing anxiety, okay, something's going on. Sadness or depression. Oh, I don't feel like going out. I just want to lay in bed. I don't want to do anything. Okay, you may want to probe a little bit to finding out, okay, what's going on? Let me ask her, let me dig a little bit more. Let me do some research along with her so that she can identify maybe for herself, oh my gosh, this is what's going on. I'm not going crazy. I'm in perimenopause, and she would be able to tell you herself. So including her in the process, I think, would be great.
Communication is so key. Doctor, we've got about a minute left, and we've got a good question here that I really want to get to before we end the show, and it's from Wendy, and this is what she writes. My doctor mentioned hormone therapy. What exactly is that, and how does it work? I know we could take probably an hour on this one, doctor, but we have about 1 minute, so let's try to get that in.
I'm going to crank it out. Okay, so hormone therapy is basically replacing some of those hormones that we lose, primarily estrogen and progesterone, right? So hormone therapy includes kind of replacing what is lost during the perimenopause phase, as in what is low during this phase. I want to say there's been research and has found really helpful effects with vaginal dryness, hot flashes, mood, even dealing with those joint pains and stuff. However, like with anything, there are pros and cons and there are risks associated. So you really have to contact your OBGYN or your primary, and please get some medical advice whether hormone therapy would be a good fit for you, because it's not one size fits all. It really has to depend on you as a person and what are the benefits versus the risks to you.
Great information. Doctor, thank you so much for your insight. As always, it's always a pleasure to have you on the show.
Thank you so much, Olga, and thank you for covering again such an important topic.
you.
And please, if there are any questions, send it my way. I will be
Thank you.
happy
We'll
to
see you
answer.
next time right here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hannah. Ask Hannah is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hannah has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit AskHannah.tv today and take control of your health with Ask Hannah. Your health, your way, anytime, anywhere. Ask Hannah, your trusted health companion.